Well, this is a very important topic for me because we have been working on this topic for a long while. Early relapse, which meets the definition of functional high risk, has been recognized, and it was one of the educational session topics last year at ASH. And there are attempts from different big groups such as CIBMT or WBMT who try to develop scores to predict early relapse. And 2 years ago, with an EBMT based on 15,000 of patients, we were able to develop a novel score based on ISS at diagnosis and 2 additional parameters which are for the time before the stem cell transplant. So those are performance status and response status. So there are 3 parameters related to disease, patient, and also the treatment effect. Combining these 3 factors, we were able to define 5 categories of patients with very low versus very high risk patients. And within the population, there were like 15% of early relapsing patients. We wanted to validate this in an external cohort, and the World Bone Marrow Transplant Registry was very helpful in that sense. 5 registries, including CIBMTR from Japan, from Australia, from the Mediterranean region, and also plus additional data from EBMT, which was not included in the original study. Again, we collected 15,000 of patients, and we were able to validate our score. In the original study, there was a lot of missingness in terms of cytogenetics, and that prevented us to search for the impact of fish in that score study. Here in this new analysis that we are presenting on Monday, we have been able to look at the impact of fish, and it shows that within the standard risk or high-risk patients, the score is active. It shows that the separation of the curves are less in the standard risk, but higher in the high-risk patients. And so there is no need to add cytogenetics into the score because it's active in both categories. I hope that for future trialists who are trying to address patients who are having the functional high-risk feature ahead of time can include the score within their inclusion criteria so that we can adapt it and have it being used in a wider scale.